Oral cancer can appear anywhere in the mouth, including the inside of the cheeks and the gums. It is a type of head and neck cancer. It often comes under the category of oral and oropharyngeal cancer. Oropharyngeal cancer affects the back of the mouth and the lining of the throat. According to the American Cancer Society (ACS), around 53,000 Americans will receive a diagnosis of oral or oropharyngeal cancer in 2019. The average age at diagnosis is 62 years old, but around 25% of cases happen before the age of 55, say the ACS. The disease is more likely to affect males than females. Symptoms in the early stages: there are often no signs or symptoms of oral cancer. Smokers and heavy drinkers should have regular checkups with the dentist, as tobacco and alcohol are risk factors for mouth cancer. The dentist may be able to spot any signs at an early stage. Leukoplakia: this is where there are white patches in the mouth that do not disappear when a person rubs them. Oral lichen planus: this is where there are areas of white lines with a reddish border, possibly with ulceration. Many oral lesions may be precancerous. They do not mean that someone has cancer, but people should speak to the doctor about any changes that occur in the mouth. Monitoring changes may help spot mouth cancer in the early stages when it is easier to treat. Cancer: if cancer develops, a person may notice patches on the lining of the mouth or tongue, usually red or red and white, bleeding, pain, or numbness in the mouth, mouth ulcers or sores that do not heal, a lump or thickening of the gums or lining of the mouth, loose teeth with no apparent reason, poorly fitting dentures, swelling in the jaw, a sore throat or feeling that something is stuck in the throat, a hoarse voice, difficulty chewing or swallowing, difficulty moving the tongue or jaw. Treatment will depend on the location, stage, and type of cancer, the individual's overall health, personal preferences. There are a number of options, as we describe here. Surgery: a doctor may recommend surgery to remove the tumor and a margin of healthy tissue around it. Surgery may involve removing part of the tongue, the jawbone, lymph nodes. If the procedure significantly changes the person's appearance or their ability to talk or eat, they may need reconstructive surgery. Radiation therapy: oral cancers are sensitive to radiation therapy. This treatment uses beams of high-energy X-rays or radiation particles to damage the DNA inside the tumor cells, destroying their ability to reproduce. External beam radiation: a machine targets the affected area with radiation beams. Brachytherapy: the surgeon will use radioactive needles to deliver radiation to the tumor inside the body. A doctor may recommend this for people with early-stage tongue cancer. Adverse effects of radiation therapy in the mouth may include tooth decay, mouth sores, bleeding gums, jaw stiffness, fatigue. Skin reactions, such as a burn treatment, will likely be more effective in people who do not smoke or have already quit. A person with early-stage mouth cancer may only need radiation therapy, but a doctor can recommend combining it with other treatments to reduce the risk of cancer progressing or recurring. Find out more about radiation therapy here. Chemotherapy: if cancer is widespread, a doctor may recommend combining chemotherapy with radiation therapy. Chemotherapy involves using powerful medicines that damage the DNA of the cancer cells. The drugs undermine the cell's ability to reproduce and spread. Chemotherapy medications destroy cancer cells, but they can sometimes damage healthy tissue, too. This can lead to severe adverse effects. These effects may include fatigue, nausea and vomiting, hair loss, a weakened immune system and increased risk of infection. These effects usually go away after a person finishes their treatment. Learn more about chemotherapy. Hypothermia therapy: in this emerging technique, a doctor will heat the area above normal temperature to damage and kill cancer cells. This therapy method can also increase the sensitivity of the cancer cells to radiation therapy. Please like and subscribe my channel.